Hello, hello. Welcome to Warriors Talk with author and founder Lady Rochelle, where we move away from awareness towards action. It is Breast Cancer Awareness Month, and in recognition of that, I have been given 31 breast cancer awareness facts. We are on day 14, and tonight we're going to talk about preparing for radiation, if I could get it out. So we're going to talk about how to prepare for radiation. And if you have had a cancer diagnosis or you know someone that may be going through cancer and they haven't had their radiation yet, so they may want to tune into this video and find out exactly what's going to happen when you go in for your radiation treatment. So let's start with, first off, what is radiation therapy? And I know when you think about it, many of us think about like getting radiation from the sun, and you know what it does to your skin already when you go and stay out into the sun too long. So when you're getting treatment for cancer, the radiation therapy that they're using, it's high energy beams to treat the cancer, and it works by damaging the cancer cells, and it makes it hard for them to reproduce. But it also damages the other cells as well. But those cells are able to reproduce and be born again and flourish. So radiation therapy, your doctor would recommend it if you need it in addition to maybe chemotherapy, or it may be the only treatment that you get. If you don't have like surgery, they may say, oh, you just need radiation. Then that's great. Then you know that you're probably in those early stages if you're not having a lot of treatment. So for me, I ended up getting chemotherapy first, then surgery, then radiation. So my chemo ended in June, on June 27th, the day before my birthday. The doctor gave me a month off, and then I had surgery in August 15th of 2014. And then I started radiation in, I want to say September. Yeah, I want to say September. No, I think I started it. She gave me a month off from surgery, and then I started. So I think it was like around September when I actually started the actual radiation. So now that we know what radiation is and what it does to the body, it breaks down those cancer cells so that they won't reproduce anymore. So it depends on what the doctor tell you, how often you're going to be having treatment. So I had 33 rounds of radiation. Yes. And so it takes days and weeks for the cells to start to die once the treatment starts. And then once the treatment is over, the radiation is still working. So even though, I finished the 33 rounds of radiation, the treatment was still working. So the doctor may tell you that, in conjunction with chemo, you need radiation, or in conjunction with surgery, you need to take radiation, or you might need to do all three. So what should you expect when you're going to your radiation treatments? What are they going to tell you to do? Is it going to be like chemo? Are you going to be, losing your hair? All of the things that come along with the side effects with chemo. So what's going to happen? So your first appointment is called a simulation. So they're going to have you to come in first so that they can like do an assessment to try to figure out, what it is that you need. So before you even begin treatment, they're going to set up an appointment with you, and they're going to do an evaluation to set up your planning for your treatment. And so this is done so that they can map out like your treatment site, where you're going to get the treatment, what's your correct dose of radiation, do you need to have 33 rounds of radiation, and they want to make sure that the radiation is only getting to just that part that needs it, and it's not, going outside of that at all. So when you come in, what they're going to do is they're going to take x-rays of you, and they give you little tattoos. So the little tattoos are little dots, and they do it right there in the office where they can mark where they're going to put the radiation piece. So they will have you to come in and you would lay down, you would lay down on the radiation table, and then they will fit you for the piece when they get ready to do the radiation. So wherever you're going to have the radiation, they're going to create a piece for you, and then they're going to give you permanent tattoos. They're going to do the tattoos there so they know exactly where to lay the pieces on you when you go in. And so the simulation process, it takes about 60 to 90 minutes when you come in. And the purpose of you doing the simulation is to make sure that they are going to be giving you the treatment in the right area and how to position you. So they're going to take photographs of you to make sure that they're positioning you the right way. So when you come in for your setup procedure, then they have you to lay back down on the table to make sure that the piece that they made for you is correct, and then they position you in the right way. So if you're getting radiation for, breast cancer, they would have you to lay on your back, and then you would raise your hand above your head so that whatever area they're going to give it to you, your hand is up, and then they give it to you in whatever area. They could give it to you from the collarbone all the way down to like underneath your ribs, and all the way, to here, because you got lymph nodes inside of there. So, yeah. So then once they know that the piece fits and that you're positioned right, then they take more pictures of how you're positioned so that they know that when you come back, you're in the right position. So then you'll come back for your appointment. And the appointments my appointment took all of 15 minutes from the time that I got out of the car, the time that I got undressed. So they'll have you to undress from the waist up, so you can keep your bottoms on, you can keep your shoes on. And I remember I used to come with my wig on because my hair was bald, and the doctors in there would be like, nope, take the wig off, let your bald head show, leave the wig in the dressing room, And so I was like, because I don't know, I just, I didn't want to be in there like that, but it was radiation, so they was like, no, just leave the wig in there and just come naturally. So that's what I did. So then once they have you to get undressed from the waist up, and then you just go in there. I'm kidding you. I'm serious. It took all of 15 minutes, if that, and I did it for 33 days. So I would go in the morning before I went to work. I would have to be there at 8 o'clock in the morning. So I would just, get there at 8 o'clock. As soon as I get there, I just walk in the back, undress, and then they would usher me into the room. I would lay on the table, and then the beams will come, and they will concentrate on that spot. And then when I was done, I would just get dressed and go. And I was with them for 33 days, and I was so happy when my last day was done. So in between your 33 days, you will be seeing a doctor. Like, they will come in and check and see, just to make sure everything is going okay and you're not having any issues. And also they have protective gear that they will put on your body so that your other organs or parts of your body is not getting the radiation. Like, they may put something on your throat. And for women, they put something like where your ovaries are. So, in case, you want to have babies, they're not messing that up. So they just make sure that, all the procedures and safety measures are taken. So you do get side effects when it comes to radiation. There are side effects, not as bad as it is for chemo. I would say for radiation, for me, I had minimal side effects. Like, a lot of people complain about radiation or they was afraid of radiation, but for me, I really, that was the easy part. So doing radiation therapy, your skin and your hair and those areas, they're being treated too, so they're going to change. They may, you may have to shave. They're going to tell you before you come in, don't put on any perfume, any deodorant, or anything like that. So when you come in, they don't want you to wear any of that. You just come in natural, so it won't interfere with the radiation. So another side effect is that your skin may turn colors. If you've ever been sunburned before, then you know what that looks and what that feels like. You may develop some sort of blisters. That skin is going to start peeling off. It's going to become real sensitive and itchy, and they'll tell you what to use, some type of over-the-counter cream that you can buy and put on there until, until it gives you some sort of relief. And so they say that, you will lose all the hair under your arms to where it's being treated. And they say it grows back within 2 to 4 months, but mine has never come back at all. Nope, it has never come back. So you're going to be fatigued. I think this may be the only one I got, and I think I was already fatigued from chemo, so I really didn't know the difference. If you ask me, I didn't have any side effects from radiation because I was already fatigued from chemo, so I think it just blended in with me being fatigued. So, but they say that you feel fatigued. The skin reaction to, they say that it worsens like a week or two after you start treatment. After you stop treatment, it's supposed to be really bad. But then after that, it starts to heal. Well, they say it takes anywhere from 3 to 4 weeks for your skin to heal once you're done with treatment. Once you're done. So my area, my chest, where they did the radiation, it was so black. When I say, you know how something is burnt, how it looks when something is burnt, and you see how it's black, and then it's crisp, it gets like crisp, it gets hard. Like that's exactly how it was. And it just, I started putting, I think I brought like some, I don't know what kind of cream, Aveeno cream or something like that. And I just started, rubbing it on there like every day just to give it some relief so it wouldn't be like tight. And, and I would like take off my bra and I would see like the black little dead skin cells, and then it left my one side of my chest a little darker than the other. And it's still a little darker, but not, it's not noticeable. But, some people ask, does radiation hurt? The only part that hurts is probably when the skin blisters up, and you're waiting on it to heal. It's a sore, like you've been burned. So if that part hurts, but the actual getting the radiation, no, that part did not hurt. It didn't. I didn't remember feeling any pain. Just sitting there as the beams were shining on that spot. No, I didn't. It was just when the skin started to blister and dry up like a sore and peel off. And that's about really it. So I did 33 rounds of radiation in 2014. I think I started in September and then I finished in no, I started in October and I finished in November. I finished November, the week before Thanksgiving. I was done. So I was so happy to be done with it. So there you have it. So if you know somebody who is in cancer treatment and they have to do radiation, let them see this video or give them the information. Dealing with cancer and cancer treatment can be really scary. It can be a horrific situation, but you have, other people have been through it and, they're still here. And yeah, you have the side effects and, you deal with it. Just like with anything, you deal with it and you just keep moving. And thank God that, you're alive and that, you made it here. So I appreciate you guys for listening in on tonight. We're on day 14 for 31 days of breast cancer awareness facts in recognition of Breast Cancer Awareness Month. So we're on day 14 is preparing for radiation. So join me tomorrow for day 15. So I'm excited about that. We're 14 days out of the way. So I'm going all the way into October 31st. And so that hopefully you will walk away turning your awareness into action when it comes to breast cancer. So this is author and founder Lady Rochelle with Warriors Talk, where we are changing lives one warrior at a time. Thank you for tuning in.